This is the fourth video in my healthcare bill video series, and I can tell you this thing's going to be thick. There's going to be lots of videos on this. So we've only made it to page 13, and we're talking about section 2712 of this healthcare bill. Okay, and that we found on page 13. And in that particular section, it mentions something called 2702C and 2742B. Now, in order to know what in the thunder I'm talking about, you have to consult something called the U.S. Code. And the U.S. Code is a compilation of United States permanent federal laws that are on the books today. Okay? So, where do you find 2702C? Well, you have to go to U.S. Code, Title 42, Chapter 6A, Subchapter 25, Part A, Subpart 1. You need to write this down and look it up, because I tell you what you're going to find is unbelievable. So, U.S. Code, Title 42, Chapter 6A, Subchapter 25, Part A, Subpart 1. And when you get there, what you're going to find is something called Prohibiting Discrimination Against Individual Participants and Beneficiaries Based on Health Status. And there's going to be all these funky little letters. Letter A talks about ineligibility to enroll. Letter B talks about premium contributions. Letter C talks about genetic testing. This is the letter C they were talking about in 2702C. Genetic testing. Basically, this law says, this new healthcare bill says, that a health insurance company cannot require you to take a genetic test. And if you do take a genetic test, they cannot deny you coverage based on the results of that genetic test. Now, I don't know how much of a victory that is, but at least now you know. In the next video, I will talk about Section 2742B and tell you what that is. So, stay tuned.